Hi everyone, welcome back to my channel. I hope everybody had a great weekend. Today's video is going to be my first ER story time, and I'm going to talk to you guys about a patient that I had recently who suffered a stroke. Now, for those of you who aren't familiar, strokes are typically caused by two major things. Either a clot, where blood is being blocked and the brain starts to lose oxygen, or a bleed where the blood vessel inside the brain has ruptured and the patient is bleeding into their brain, causing increased pressure inside their head, which is extremely dangerous. Now, this patient was actually at work when all of his symptoms started, and his coworkers are the ones who noticed that he was behaving a little erratically. His speech was a little bit slurred, and they noticed some right side facial drooping, and the patient had been complaining that he was having some right arm and leg weakness. So they went ahead and called 911, and he came in by EMS as a code stroke, which is how we categorize patients we think could potentially be having a stroke. Now, as soon as he got into the ER, we did all the things that we are supposed to do. We did an EKG, did blood work, took him up for a scan of his head so that we could determine exactly what type of stroke the patient was having. And in his case, it turned out to be a massive bleed in the left side of his brain. So for those of you who aren't familiar, when you have a stroke, the side of the brain that's affected and is having damage is going to be the opposite of the side of the body that actually shows symptoms and is affected. So if it's the left side of the brain where the bleed or the blockage is occurring, the right side of the body is where you're going to have deficits. And the opposite is true. So if the right side of the brain is where the bleed or the blockage is happening, the left side of the body is where you're going to have deficits. So in his case, left-sided brain damage, right side affected. So we took the patient back downstairs to a room, got a neurology consult, and we noticed that he was having extreme right side weakness to the point where he couldn't really lift his arm or leg, and he was complaining of blurred vision to his right eye, which quickly escalated to complete loss of vision in the right side, which meant that his bleed was growing very fast and his elevated blood pressure was not helping. So the plan of care for this patient was to regulate his blood pressure with a cardiac drip and to intubate him so that we could let his brain and his body rest. So we did that, and unfortunately his blood pressure just kept getting higher and higher and higher, and the prognosis just wasn't good. There was nothing, it seemed, that we could do to manage his blood pressure safely, and we really thought that we were going to lose this poor man. And unfortunately, we weren't able to get in touch with his family right away. So we stabilized him as best as we could and took him up to the ICU under the belief that the patient probably wouldn't survive the night. Now, once his wife came into the ER, come to find out, she was a neuro ICU nurse at a local hospital, and she knew pretty much that his prognosis was not good. And she was absolutely devastated, which broke my heart. So we got her upstairs to be with her husband and just prayed for the best. Now, I've been checking back on this patient just to see how he's been doing, see if he's still hanging in there, and I can tell you guys that he's actually doing much better than what we thought he would be. He's still alive and kicking. He's been extubated, so he's breathing on his own. He's been able to respond to some commands. He's able to speak a few words, but unfortunately he's not regained movement on the right side of his body just yet. I'm very hopeful that once he goes through rehab and is working with speech therapy, physical therapy, and occupational therapy, he'll be able to get some of that back. But I don't know that he'll ever be back to 100%. But I'm very thankful that he's alive and well today, because his story just really struck a chord with me. I mean, I just couldn't even imagine getting that call that your spouse, who you believe is at work, has had a massive stroke and had to be rushed to the emergency room. I mean, that would be enough to crush anyone. But he's doing so much better today. And I'm so thankful that I was able to do my part to help save that man's life. So that's pretty much it for my story time for today. If you guys have any questions or any concerns, go ahead and leave a comment down below. Don't forget to like and subscribe, and let me know what you guys want to see in the next video. If you guys want another ER story time, believe me, I've got plenty. Thank you guys for tuning in, and I'll catch you in the next video. Bye.